Hello, and welcome to Mastering Medicare, the series where we cut through all the confusion and debunk the myths surrounding Medicare so you can make informed choices about your own healthcare coverage. I'm Dr. Lance Coss, and I'll be your host for this ongoing series. Why me? Well, I've spent over 3 decades working inside the Medicare system. I currently lead a national organization dedicated solely to improving healthcare and protecting the rights of Medicare patients. Every day, my team and I work to ensure that Medicare beneficiaries receive the right care at the right time and in the right place, advocating for patient rights and holding providers accountable for providing quality care. Through my 30 years in the industry, I have pretty much seen it all at this point, which means I see firsthand just how overwhelming and complicated Medicare can be. And that's exactly why I'm doing this series, so that I can help you and your loved ones avoid those costly mistakes, cut through all the bureaucracy and red tape, and navigate Medicare with confidence. This web series is based on my latest book, Mastering Medicare 65 Things Everyone Should Know by Age 65. Over the upcoming episodes, we're going to use this book to break down the biggest mistakes, misconceptions, and myths that trip people up when it comes to Medicare. Think about this. Every day, more than 11,000 Americans enroll in the Medicare program. And let's be honest, most are simply unprepared for the complexities, costs, and choices they will face. From navigating enrollment deadlines to understanding coverage gaps, many beneficiaries make costly mistakes simply because they don't know any better. This series is designed specifically to fix that problem and provide my listeners with the resources and knowledge you all need to make informed decisions about your own healthcare coverage. Whether you're turning 65 soon, you're already enrolled in Medicare, or you're just helping a loved one through the process, this series will help you make informed, smart decisions. We'll cover everything from when and how to enroll, what Medicare actually covers, and more importantly, what it doesn't, the costs you should plan for, and how to avoid the penalties that catch so many people off guard. If you think Medicare is simple, think again. But don't worry, I'll guide you through step by step. So let's kick off the series with one of the biggest Medicare misconceptions I see constantly in my work, the idea that Medicare is free. Well, big time spoiler alert, it's not. I've talked to countless people over the years who all had this common misconception about Medicare that it's free, since most people spend their working years paying regularly into the system. However, Medicare is not a fully prepaid benefit. It's actually a cost sharing program where beneficiaries still have to pay premiums, deductibles, co-payments, and co-insurance, just like you would with any other insurance plan. As a quick reminder, Medicare is broken up into 4 parts: A, B, C, and D. Part A is for when you're in the hospital, and it is free for most people, which is probably where the misconception it came from in the first place. Medicare Part B covers outpatient medical services and includes things like doctor visits, preventive care, diagnostic tests, and even durable medical equipment like wheelchairs and walkers. In 2025, the standard monthly premium for Medicare Part B is $185, so you'll pay that every month. Also, don't forget that you have a deductible to meet under Medicare Part B, and the annual or yearly deductible for Part B is $257 in 2025. That's up from $240 last year. Medicare Part C, also known as Medicare Advantage, is an alternative to original Medicare that provides Part A, which is your hospital, and Part B, which is your regular medical coverage, and often includes additional benefits like vision, dental, hearing, and prescription drug coverage. These plans work similar to an HMO, and the cost will vary based on the plan you choose, even where you live, and the provider networks they use, with some plans offering $0 premiums, while others may have higher monthly costs, copays, and even out-of-pocket maximums. Medicare Part D provides prescription drug coverage through private insurance plans that are pre-approved by Medicare, helping beneficiaries lower the cost of medications. In 2025, the costs vary by plan, but most will include a monthly premium, an annual deductible, which is capped this year at $590, and co-payments or co-insurance based on the medication tier. Even worse, higher income beneficiaries may pay more due to something called the Income Related Monthly Adjustment Amounts, or IRMA. And believe me when I say, IRMA is not your best friend. IRMA is an extra monthly charge added to Medicare Part B and Part D premiums for higher income beneficiaries. It applies to individuals whose modified adjusted gross income exceeds certain thresholds, and that's based on your federal income tax returns from the 2 years prior. So, for example, if you're just joining Medicare in 2025, they'll go back and look at your 2023 and 2024 federal income tax returns. If you made more than $106,000, or as a couple, you made more than $212,000, well, congratulations, you will now have higher premiums. And that can range from anywhere from $259 all the way up to almost $630 per month, depending on that income level. In upcoming episodes, we'll be talking about all things enrollment related because if you don't enroll in Medicare when you're supposed to, you can face penalties that will increase your premiums, and that's for life. I like to tell people that at its core, Medicare is simply a super large insurance company. So when you're questioning something about Medicare coverage, ask yourself, would Aetna pay for this? Would United Healthcare pay for this? If the answer is no, then chances are Medicare won't either, at least not without some cost sharing, rules, and even restrictions. So before we go any further in this series, let's get one thing crystal clear. Medicare is not entirely free, and if you don't understand that simple concept, you're already setting yourself up for some financial trouble. And that's just one of many common Medicare mistakes we'll be covering in this series. In the next episode, we're going to talk about another big pitfall, thinking that Medicare covers everything. Well, early spoiler alert, it doesn't, and what isn't covered might actually surprise you. So make sure to subscribe, like the video below, and drop any Medicare questions to me at my website, lanscoss.com. Thanks again for watching Mastering Medicare, and I'll see you next time.